Hello everyone and welcome back to the channel. Today I'm going to be talking about quite an unusual but very interesting psychological disorder, that is Munchausen Syndrome, which is also known as the factitious disorder. Munchausen syndrome was first described in 1951 by a psychiatrist named Asher, who reported individuals who intentionally produce signs and symptoms of a disorder to seek medical care. Munchausen syndrome is a rare psychological disorder where individuals deliberately pretend to have physical or mental health problems. Essentially, it's a behavioral condition in which somebody fabricates or induces symptoms of illness in themselves. The name Munchausen, from Munchausen syndrome, is named after a German aristocrat named Baron Munchausen, who was quite famous for telling very wild and very unbelievable tales about his exploits and his past. So to understand Munchausen syndrome, it's important to grasp the motives driving those who suffer from it. Often individuals with this disorder crave attention, sympathy, as well as validation. They may have unresolved emotional issues or an intense need to be cared for. Some even enjoy the sense of control that they have over their own medical narrative. People with Munchausen syndrome typically display a set pattern of behavior. This pattern of behavior includes lying about their symptoms and typically also lying about other aspects of their life, such as their past or level of education. They manipulate test results to suggest the presence of symptoms, such as adding blood to urine samples. They also might actually inflict symptoms upon themselves, such as self-poisoning with an overdose of medication. And finally, they generally travel from hospital to hospital in different parts of the country, seeing as many different doctors as they can. People with Munchausen syndrome differ from two more common types of feigned illness, namely hypochondria and malingering. People who have hypochondria actually believe they are ill, and so do not manipulate test results to prove that they are ill because they genuinely believe that they are ill. On the other hand, people who malinger pretend to be ill to gain some sort of benefit, such as avoiding military duty or trying to obtain some level of compensation. People with Munchausen syndrome know that they're making their symptoms up and can be highly manipulative, but their behavior brings them no obvious benefit. Instead, they often undergo painful and sometimes life-threatening surgery, even though they know it will be unnecessary. Diagnosing Munchausen syndrome can be incredibly challenging, namely because patients are skilled at manipulating medical professionals, and they go to great lengths to maintain their deception. Doctors have to consider various factors such as extensive medical histories, inconsistencies in symptoms, and a lack of response to treatment. It's hard to estimate how many people are actually affected by Munchausen syndrome because they tend to be highly secretive and often use a number of false identities. Once their deception is uncovered, they discharge themselves from hospital and then move on to a different area. Overall, the condition is thought to be most common in white men aged between 30 and 50, and it's not quite clear why this is the case. In terms of causes of Munchausen syndrome, they're largely unknown. Most people who have been diagnosed with the condition refuse to accept any sort of psychiatric treatment, so little is known about their motives or thought processes. There is a consensus of opinion that Munchausen syndrome is a type of personality disorder, which are a class of mental health conditions in which an individual has a distorted pattern of thoughts and beliefs about themselves and others, which leads to them to behave in a way that most people would regard as disturbed or abnormal. One theory is that people with Munchausen syndrome have an antisocial personality disorder, which causes them to take pleasure in manipulating and deceiving doctors. They may see a doctor as a figure of authority, so tricking these figures of authority gives them a sense of power and control. Another theory is that Munchausen syndrome is an attempt to form relationships and become more socially acceptable. People with Munchausen syndrome are often considered to be loners who have little contact with their family and few friends, so they take comfort in adopting the role of a patient and find that this relationship between being a patient and their doctor provides a much needed source of human contact and emotional warmth. A diagnosis of Munchausen syndrome can usually be confidently made if 3 conditions are met. 1, that there is clear evidence of fabricating or inducing symptoms, the person's prime motivation is to be seen as sick, and there is no other likely reason or explanation for their behavior. I was looking and trying to find a case study syndrome and other cases classified as malingering. A lot of the results that appeared in searching for these cases to me made it seem like these individuals were doing it primarily for some type of monetary gain rather than the aspect of needing that doctor-patient relationship. However, one of those I did find was a person named Alan Knight. So Alan Knight was also known as Sick Note, and he is a notorious British criminal who gained his notoriety from his extensive history of faking illnesses and injuries. So born in South Wales, Alan Knight began his deceptive behavior in the late 1980s, and this continued for several decades. His modus operandi involved feigning various health conditions to receive sympathy as well as financial support. He would often use props such as bandages, casts, and medical equipment to support his claims. His manipulative behavior extended to fabricating documents and medical records to convince medical professionals and individuals around him of his supposed illness. One of Knight's most audacious acts involved intentionally inflicting injuries upon himself. So this is where I think it's a real case of Munchausen syndrome and not just a kind of prop for financial gain. He would use implements such as scalpels and scissors and even chemicals to harm his own body, creating the illusion of medical emergencies. This extreme behavior aimed to ensure that his deception would be believed and result in additional attention and support. So here he's ticking all of the boxes of a genuine case of Munchausen syndrome. Over the years, Knight's actions resulted in a significant financial loss for the individuals who supported him, including his own family members, friends, and even charities. It is estimated that he defrauded people out of thousands of pounds through his deceptive ruse. Knight's deceitful behavior came to light in 2013 when a concerned neighbor reported him to the police after suspecting that he was not as ill as he claimed to be. Upon investigation, the authorities discovered a trove of evidence, including fake medical documents, equipment, as well as the previously mentioned props. In 2014, Knight was arrested and charged with fraud and forgery related to his extensive history of deception. He was subsequently convicted and sentenced to prison for a total of 4.5 years. Despite his conviction, Knight remained unrepentant and continued to maintain his innocence, claiming that all of his medical injuries were in fact genuine. So, Munchausen syndrome not only affects the people who are feigning these illnesses, it also takes up important times of doctors, nurses, and all the medical staff, as well as affects those in their general vicinity who support them and want them to essentially get better from a disease that they did not have. And doing that fulfills the need of the person with Munchausen syndrome to get the attention and care that they so desperately desire.